If only I had more time in my day. Have you ever thought that? When it comes to the workload for doctors and others, it can sometimes seem like the workday never ends in many ways because of the paperwork that needs to be completed.
Feels like we finally did something that really did reduce burden on frontline. That reduction of burden translates into happier, workplaces, and really goes back to the OSF mission. Like we're more energized to be able to do the things that we intended to do.
That's Dr. Tyler Fitch, Chief Medical Information Officer, and I'm Shelley Dankoff, your host for OSF HealthCare Accelerated. We appreciate you tuning in and remind you to be sure to subscribe, rate, and review wherever you get your podcast. The 17th century proverb goes, "A stitch in time saves 9." It's a metaphor that suggests that addressing an issue right away can prevent it from escalating into a bigger issue, perhaps more costly one, or a more difficult problem later on. It's a reminder to be proactive and take care of problems before they become overwhelming. In 2024, OSF HealthCare piloted the use of DAX Copilot with an eye on how it could make lives, particularly those of doctors, nurses, and other providers of care, easier. Now that we have some data under our belt, we want to check in and see how things are going with DAX Copilot. To do that, we are joined by Dr. Tyler Fitch, Chief Medical Information Officer for OSF HealthCare. A couple of his colleagues will be joining us shortly, but I want to start with you. We sat here about a year and a half ago, and you started talking about some of the cool things that were going on with generative AI, and this was one of those that was on the horizon. And you were getting ready to launch the pilot. Okay, tell me about building up to that, the pilot launch, and how things are going.
Yeah, we did it.
Yeah.
So I think it's not been a year, but it's been a while. And so we have a lot of data back. We have a lot of good data. So if you'll kind of remember back to our conversation then, generative AI was a newer thing. ChatGPT was hitting the market, and people were starting to deploy uses of generative AI. And a lot of the industry was saying, hey, physician notes is really going to be one of the areas where we spend a lot of overhead. So 40% or more of a day could be spent doing things that could be automated with generative AI. So we really thought this was going to be a good target. Dr. Meeker was here to talk about it, and I was here to talk about what our plans for a pilot were. We were going to track some things. Really, we were going to look at things like pajama time. How much are nurse practitioners and physicians, how much time are they spending after hours in the office? So we looked at that. We also want to look at what do patients think of it. So we wanted to get the voice of the patient and ask surveys. So when they've had this experience, did they think their physician listened to them, which was one of the goals of this, be able to have a conversation like we're having instead of behind a computer. And then we also wanted to look at, is this cost effective? Can we sustain something at a large scale, something that's an expensive, new, cool product? So we conducted a pilot. We did finally go live. It was July 15th. I still remember. So it was July 15th was when our first users went. And we had a smaller group at that time because it was really testing out, very new, not a lot of applications at that time. So we tested it out on July 15th, and we ran about a 3-month pilot, which concluded about through October is when we kind of finalized and discussed all the results with a lot of the other business leaders. And we found it did great in all those categories. And so we had a lot of anecdotal stories from some of the users, and hopefully we get to hear some stories like that in a little bit here. But we also showed a lot of statistical data that what we were trying to achieve in making lives easier, in spending less time in the office after all the patients are gone, and more time with families. And then a lot of the other things, like, are they getting the other tasks in the office done? Like, are they doing things that can be cumbersome to do in the middle of when you're trying to weigh, should I be doing a note or do I need to respond to this patient right now? So there's a couple things that they're balancing. Are you able to get all the other work done? And we saw across the board improvements. So things like 20 minutes on average earlier every day, leaving every day or 20 minutes earlier. We saw turnaround time for messages to patients go down by about a day, so patients are hearing from their doctors sooner. And it's absolutely financially viable without any strings attached with this product. People are seeing additional patients. We're hearing anecdotal stories. It's not a requirement to use it because we really wanted to focus on the burden, but we are seeing that people are organically seeing patients. So it's fantastic. Almost kind of a too good to be true from a software deployment. We don't always see this kind of thing.
From your perspective and from doctors' perspectives, it's for people who don't understand. Yes, you're seeing a patient here in the office. You're coming in for whatever X, Y, and Z visit, and I'm going through it. People don't understand how that's not when the doctoring ends. There's a lot of other stuff. So walk through. You kind of hit on some of it, but yes, I'm talking to you in person, but I have to write all that stuff down. Yep. And that takes time.
Yeah, and those notes are complicated. They're not just a scratch of what happened, because you've got things like the insurance companies that want to read what's in the note. The patients can see the notes too, so you want to make sure that's in mind and that we're transparent, but we also need to communicate what we need to other providers. So there's this balance of what kind of language do I use? Do I use technical language, or do I use something that the patient would be able to read and understand? So there's a lot of considerations. And then when you're doing your encounter, you may need to be putting in orders, or you may need to be updating other areas of the chart like history, problem list, or and getting in things the patient needs. So you've got a lot of things to be doing, and it's very easy to just sit behind the computer and do those at the same time you're talking to someone. And as we all know from talking to people when they're kind of half paying attention to you texting or something like that,
right,
that experience isn't the same as looking someone eye to eye and knowing that things are happening behind the scenes that you're not going to have to deal with later.
Well, I remember even just seeing my primary care physician initially, and they're taking the notes, and they're apologizing because when they were real time trying to type it, it's very hard to rub your head, pat your stomach, and walk, talk, and chew gum at the same time. I get it. It's very difficult. So this became DAX Copilot. Talk about what DAX does, how it works, and what it's designed to do.
Yeah. So what happens is our electronic health record is called Epic. So we really are a single tool in all your records. If you go to My Chart, that's where you see your information. And so this is all contained within the health record, but it's through another company, which Microsoft now owns. But the software is called DAX, DAX Copilot, and within the Epic version for physicians on the phone, which is called Haiku, there's just a record button. So really all it does is you take your phone out, you hit the record button, and you set it on the table, and then you just exit the computer and have the conversation. The recording is then digested and processed into a completed physician note in a matter of a few seconds after the record button is ended. So all that work, and physicians can take anywhere from 5 minutes on a real quick note to 30 minutes on a long note. You never know how long it's going to take to put everything in there. That's all done in basically real time as part of the conversation. So it's kind of like magic the first time you see it, but there's people have their different styles. So people do various amounts of editing sometimes because it really is the physician's ownership in the end. It's not just the AI doing it. The physician still needs to say, yeah, this is what happened, this is what I said, and sign off on it. So it's not zero editing, but it is very little compared to how much, on average, compared to how much time is spent on those.
And just for clarity on this one, a patient has to sign off on it because it is listening. It is ambient listening to what's going on in the room,
Yes.
and then transcribing what is being said. But sometimes I think some people might get a little weirded out by the technology because it's still new, or, maybe you've done talk to text, and let's all be honest, sometimes talk to text doesn't come out great. So educating the patients, I'm guessing, has been a part of this process as well?
Yeah, one of the, it'd be great if we could just flip a switch and every one of our, 1,500, 3,000 physicians could have access to this. But really what you're speaking to there is the rate limiting step. We need to make sure our patients are comfortable with it, that our offices are educated, that we have a consenting process so that the patients, we're not doing something the patient doesn't know about in these circumstances. And that training to bring an office up to speed about being compliant with the law in terms of things like eavesdropping, or being compliant with other laws we have in Illinois, one's called BIPA, but really making sure that we're staying compliant, we're being transparent with our patients, nothing's happening that they don't know about, but then we're also getting all the advantages of having that conversation and being able to look someone in the eye while you're doing your encounter.
Well, we want to get to some of the people who are actually boots on the ground, we're excited to be participating in this. So we're going to bring in now a couple of our providers who work across OSF HealthCare throughout the ministry. Joining us are Dr. Jenna Dionisio, a primary care physician with OSF Medical Group Family Practice in Monmouth, Illinois, and Amy Dose, a family nurse practitioner located in Ottawa, Illinois. Thank you both for joining us. Very excited to have you with us. So, Dr. Dionisio, let me start with you. When you heard about this pilot and the chance to participate in this, what did you think?
First thing, I was amazed and I was very grateful. That was something I wasn't expecting to have access to when I recently started about 4 months ago. So the word that I've been hearing around the office is game changer. I kind of think of it like I'm a DAX addict. I've had instances where maybe the internet's not working and we don't have access to it. It's a little bit of a frenzy. So a lot of folks around here, my colleagues and I are really on board with it. I would agree with what my colleague had mentioned in terms of being able to focus on the patient and not being so worried about catching every single detail. But for me, that translates to not having to put so much of a cognitive load on myself. You know, by the end of the day, unfortunately, if you have that situation where you have 14, 17 notes pending, it's kind of hard to remember everything. But if we have something to prompt us, I found that just seeing the transcript helps me jog my memory and helps me to remember what happened and, you know, what the important details are. There are some downsides. I would say that sometimes with the transcript, it comes out as long paragraphs. So, you know, the balance for me is trying to streamline it, not spending too much time on editing, but making sure it's accurate. I've had a couple oopsies. I had said, you know, for a patient to use her cane every day, and unfortunately it came out use cocaine every day. So we really have to just verify even against ourselves. So just as long as I think as long as it's being reviewed every time, it can be it is a very useful tool.
Yeah, it's that talk to text thing. We've all had those moments where you're going, that's not what I said. So Amy, from your perspective, similar experience, what did you think when you had this put before you?
Well, I was pretty excited. I struggled with probably some burnout with all of the notes. I've, been a nurse practitioner for quite a long time, and I think I've always said, if someone could just write my notes, I can see more patients. And that kind of is like, I don't feel that strain. If I need to add in somebody, it's a lot easier when I know 80% of the note is done. You know, I don't have to recreate that all the time. So I was pretty excited. I was lucky enough to be in on the initial group that was in on the DAX. And the first couple of times I came running out of my office to show someone because I was so excited. I'm like, look what this can do. Look what this can do. I can't believe this is what it did. So, and I think as DAX gets to know me, it just keeps doing a better job. The notes keep getting more robust. I've figured out a few tricks to make the notes more valuable to myself and less editing. So it's a huge satisfier for me in my job these days.
You know, Dr. Fitch talked about the pajama time, because again, that's the thing. Yes, you have this real time going, but you still have to make sure it's cleaned up and the notes go at the end of the day. Have you been able to quantify how much time it has saved in your days and how much you've gotten back in your personal life?
None at the moment. I have been using it for maybe about 5 weeks or so. It recently rolled out to my office over here at OSF Holy Family in Monmouth. At the moment, it has saved me a lot of time to get all the details, but I haven't noticed it too much. I want to give it a little more time for that.
Okay.
I would say for me, it's a big deal because I was historically probably I struggled closing my charts. I will be the first to admit it. And I was probably always on the watch list a little bit. And it's improved that for me. And I feel like it's, my closure rate is much better than it ever has been probably in my whole career. And I feel that even if I do have to do some like after clinic or at home, it's not nearly as long as it used to be. It's not hours and hours.
That's awesome to hear. So what are patients saying? Walk me through the process. When a patient comes in, how do you explain this to them and get it rolling? Tell us about that.
Well, if it's a patient, and I know that they have just signed the DAX consent for my office, it can either be for that specific encounter, the patients have that option, try it out, or if they're okay with it, they can just say indefinitely, I'm okay with using DAX the entire time. So I'll prep them and I'll say, hey, this is artificial intelligence. It should filter out everything that's non-medical related. And DAX actually does a very good job about that. If we're talking about someone's, chickens and how many eggs they're getting, it typically will not make it into the transcript. And I tell the patient, I say, hey, my commitment to you is that I will absolutely edit everything. I've had those instances where it spits out the wrong thing, and that's understandable with AI, but it's edited for accuracy.
Okay, Amy?
Yeah, it's pretty much my rumor kind of goes through the whole process. And I really have had since I've been in this since July, I think I've had less than a handful of patients decline it. I think my patients want my undivided attention, which they get anyway, but they're getting even more of it. And, I can spend the first 5 minutes with no computer, not even being logged onto a computer, and talking about some of the things that are going on with them, which is just much more relaxed. Henpecking on the computer the whole time is just is a drawback for me. I didn't do it well with the patients because I want to look at them. I want to make eye contact. So it just takes that distraction of the computer away, which is just such a, it makes a great patient experience.
Dr. Fitch referenced, we can't roll it out to everybody at once. You have to, there's the education, there's everything that goes along with that. But what would the two of you say to those providers who may be on the fence? Because again, change is difficult. This is AI. This is something different with technology. What would you say to those your fellow, providers who might be a little hesitant to engage in this?
Well, we did have one kind of late to the game, and so to speak. It is totally provider preference, but there's 100% of our providers are currently utilizing DAX. We had that last holdout, and we're kind of working on him with that. But essentially, if someone is concerned about, hey, is this just one more thing I have to learn, one more thing that a person has to do? Number one, we have an excellent support system here. So shout out to Lori Horner. She's on it. She's very, very knowledgeable. So she made the process easier. But also, I use an Android. And so for a person who may be hesitant to jump to the iOS system, so worth having to buy an iPad. I would absolutely recommend it because once you download the app, it's very straightforward. You click into the patient's chart. The record button, it's clearly labeled DAX recording. So you just click on that and the recording, then that's really all there is to it. But we do have elbow support, here. So Lori spends the afternoon, let's say, just walking a provider through it and making sure a couple of the encounters go well.
Awesome. Amy?
I just tell everybody they've got to try it. You have to try it. Don't deny it. Try it. You might be surprised, right? Just like my kids, when I tell them, you got to try the broccoli. You're going to love it eventually. It may take 10 times, but you're going to like it eventually. So I think that, and I think the majority of our office there's a couple that are like, well, I don't like the paragraphs. Well, I kind of just discovered, that you can kind of customize it with some bullet points and different things now. So I was showing them that last week. I'm like, hey, look, I found this by accident. You can do some bullet points. And actually, I'm really enjoying that for my notes, so I think it's, I think it's going to continue to get better, and I think being able to just have this tool, which is a tool that we've been kind of wanting. One of our physicians up here has been dying for a scribe for the whole time he's worked here. So he got in on the pilot, and if he's a tough sale usually, and if he's given it some good praises, I know it's doing some good work.
Amy, I don't know if you can see Dr. Dionisio's face, but when you were talking about bullet points and setting up, she's like, wait, I don't think she knows that. And she's like, I have a feeling there's going to be an email going back and forth because it was like, wait, what do you mean I can set up bullet points ahead of time?
Yeah, I accidentally found it.
I need that in my life, bullet points.
Yeah,
Okay.
yeah, it's easy. It's easy.
All right. See, I can see a conversation coming down the road. But okay, now back to Dr. Fitch. When you hear this conversation, that has to do your heart good. This is what you hoped for, and you're hearing this. What do you think?
Yeah, fantastic. I'm really glad you were both able to participate in this. This is really why in informatics I do what I do. So it's real. You're right. It's like I just get excited. I could talk about this every single meeting all day because it's fine. It feels like we finally did something that really did reduce burden on frontline physicians and APPs and that reduction of burden translates into happier, workplaces, and really goes back to the OSF mission. Like we're more energized to be able to do the things that we intended to do. I do want to say a couple things on some of the things that were mentioned there. So the continuous improvement really is that's not just in your head from getting more familiar with it. Even this week, there's going to be some new specialty models, training models. So I think either yesterday or today, they're starting to roll out in 10 specialties. So we found the most success in primary care, and that's in our pilot. So when we started expanding, we did go to primary care first because we found that the transcripts were the closest to what they wanted, but it's getting better in the specialty area. So that's one thing. And then another one, like you mentioned with the bullet points. So a lot of customizability coming, some that's already here and more coming about just making it sound more like I did to begin with, rather than having to go through a lot of words in paragraphs, because some doctors like to be a little bit more succinct and bullet pointed. And so that functionality, so these things are just kind of getting added in the background, and you may find some Easter eggs if you look hard enough. So
it sounds like Amy's already found them.
Yeah,
So
she found it.
Took me a few minutes, but I figured it out. Took a couple patients, but I was like, oh, okay, this is even better.
let's talk about other cool things that might be following in the wake of this. So this is one, but I know there's a few other things on the horizon that I'm sure providers are going to be very excited about. Tell us about this.
Yeah, some of the, it takes about 2 encounters, and then people come out of the room, they say, this is amazing, you got to look at this. And then it's about one day later, and they're like, wouldn't it be great if it did this too? So they immediately start like kind of going down the line of, wow, this could be even better and better. And so we are going to be the very first in the country to do ambient orders with this. So we're partnering with DAX and Epic and are co-developing. Nobody's live, and we're going to be live in about a week or two with 10 users. We're not sure if it's going to work even initially because it's literally the very first in the country. So really exciting that we'll be able to have a conversation and say, I want a CBC. I'll get a CBC. I'll refill your lisinopril 20 milligrams, and you go kind of through the list of things you want, and then bam, they're all queued up in your orders, and you just hit sign to get them going. So that takes another step out of the process. So like I mentioned, there's going to be all these things in an encounter, updating problem list. Yep, that's going to be coming in the future. Or making sure that you're addressing a lot of their health maintenance or chronic disease conditions. Yeah, it'll file the thing in the chart that's required for that. So some of those things that are nagging at our physicians that may not be just part of that organic conversation we're talking about, they'll be able to be acted on through these conversations, and the tool is just going to keep getting better. And so it's really exciting to see where it's going. Specifically, for
medication list, because again, it will still have the backup. It doesn't automatically refill something. The physician still has to sign off on it and say, okay, no, this is what you should be taking. But that's nice. If somebody's on multiple meds and you're adjusting and you're talking and just keeping track of all of it, I can imagine that can be tiresome too. Yeah, and just keeping track.
Yeah, I know I forget some things I told patients I do sometimes. You walk out of the room and whoops, and then you remember it later, and I hope it gets to the pharmacy before they do. That kind of thing.
Yeah.
And so that if you say it to the patient, then the computer picks up on it and starts to get it in the queue to just hit a single sign button instead of having to remember, type it all out, click a lot of buttons, and again saving more time and returning the encounter back to the patient and provider interaction versus the computer.
So spring of 25, we're getting that. And so I'll put it on the calendar another year from now.
Yeah.
I feel like we bring you in like once a year to update this stuff because this isn't just about, yes, this is about patient care, but this is about provider care too, because we have to curb the burnout, and everybody deserves a work-life balance. And so we're trying to figure it out. Dr. Tyler Fitch, Dr. Jenna Dionisio, and Amy Dose, thank you so much for being here to talk about the latest in, DAX Copilot, the generative AI, and all the cool things going on at OSF HealthCare. We appreciate it.
Thanks a lot.
And thank you for joining us as well. And a reminder, you can check out all of the OSF HealthCare Accelerated podcasts at osfhealthcare.org/accelerated.